Welcome everyone. Happy Cinco de Menopause, and we'll learn how can this even be a party. And this will be fun. Postmenopausal women actually have lost about 60 to 90% of their key hormones. So hormones affect brain clarity, bone density, sexual function, metabolic health, cardiovascular health, and we'll talk a little bit about how Oprah Winfrey, how many of you have heard about Oprah Winfrey's struggle with hormones and her journey? And anybody? No? Okay, so she put out a special recently, so you can just Google Oprah special and try to watch it. And I honestly will confess that I haven't watched it, but I've read lots of her story, and it took her several years to figure out what was going on with her. So we'll talk a little bit about her and how she's trying to help advocate for all of us women as we face the menopause journey, and we want to have it in a different path than she went through. So what should every woman know about menopause? Perimenopause typically starts between 35 to 45 to 40 years old, and menopause is average of age 51. And it's typically defined by 1 year without a period. That's the classic definition, but there's a little bit of conflict around that definition now, because it's more about the hormones declining, and it's not always that 1 year without a period is like, okay, now let's start talking about it, now let's start treating. So perimenopause can literally happen 11 years before you have a period, and even before perimenopause, or before you lose a period, right? So, and perimenopause is kind of like when the hormones really start to decline, but women in their 20s and 30s can have hormone imbalance too. And even, teen years is a good time to start paying attention to your cycle and paying attention to your hormone levels. So it can lead to things that we all know of: hot flashes, mood changes, but we'll learn more about what all is entailed with menopause. So how many of you have thought that, menopause is mostly about losing your fertility? That's the main concept, but that's actually a myth, because menopause actually puts us at increased risk for cognitive decline, like dementia and Alzheimer's, heart disease, like, inflammation and thickening of our arteries and our blood vessels in our heart. It will affect our bone density, dramatic drop in bone rebuilding when we lose hormones in menopause, and putting us at more risk for osteoporosis. And then metabolic health. Of course, we all feel like aging brings the weight, and menopause and all of the hormone loss is probably the culprit. Hormone replacement therapy is dangerous for everyone. How many of you have been told that, or have thought that, or read that? Well, there was a period of time, I want to say it was around the 80s, where there was a lot of research that was being done, and it was actually very faulty research. And Sarah can even talk a little bit more about that if you guys have more questions after. Sarah, you want to say hi? Sarah's one of our lead female hormone nurse practitioners here, and she has come from the Western medicine world to the integrative functional medicine side, and so she had to prove to herself that this was true, and that this was real, and that this was going to be safe for her patients. And she dug deep into the research, and she found that the research studies were faulty, and they actually were not fair to make an assessment. So now if you hear podcasts with Huberman Lab and Peter Attia, they're talking to female gynecologists and hormone experts who've actually done more current research, and they're learning and uncovering things like Oprah needed to know, that bioidentical hormone replacement therapy is safe and actually preventative of diseases. Now, we all hear the cancer word and we think, well, aren't hormones triggering cancer? We'll talk a little bit more about that, but actually, bioidentical hormones do not trigger cancer. It's basically restoring your body's levels to what they were when they were in your 20s. And most people when they're 20 don't have cancers. Most people when they have cancer, they're post-menopause. So there actually has been found to be correlation with low optimal hormone levels, like lower than optimal, and increased risk of cancer. So hormones, when done safely and bioidentical, can actually be protective of cancers, which is very, very important to know. And you won't hear that from typical traditional medical doctors. So you're hearing special information here. And if you go with Sarah and want to learn all the PubMed citations, she will provide them for you. And also Rhonda. Rhonda can give us citations too. Rhonda's our rep from one of our bioidentical hormone suppliers. So There's lots and lots of proof, and Australia and Europe, you'll find that there's other continents that are pushing bioidentical hormone replacement in a more powerful way. So we're trying to catch us all up. I had some fun with the AI images in this presentation, by the way. So there's a myth that nothing can be done, you just got to tough it out. And that's probably an older generation myth where a lot of women even think that because they're through menopause, there's nothing else to do, that they're fine, they've crossed through the worst of it and they're on the other side, and therefore, this doesn't apply to them, this whole conversation. But we'll talk about how you can still have benefit. So, how to know what you're really experiencing. So just to run through a lot of the common symptoms, many people have heard of hot flashes and night sweats and how debilitating they can be. But brain fog and memory issues, you don't have to just think you're going crazy. You can probably blame it on your hormone decline, fatigue, low energy, midsection weight gain, mood swings, anxiety, irritability, sleep disturbances, insomnia, waking up at 3 or 4 a.m., feeling tired at 3 or 4 p.m. and needing that second cup of coffee or fourth cup of coffee, sixth cup of coffee, low sex drive, vaginal dryness, super, super common with the decline of hormones, joint pain, muscle loss. How do you know if it's menopause? A lot of people, or how do you know if it's perimenopause? A lot of people have been given, like in the traditional clinics that I worked at, they were given antidepressants, they were given anti-anxiety drugs, they were starting to have abnormal blood labs, like cholesterol was elevating, and they were starting to get anti-cholesterol medications prescribed to them. So if you want to know a really crazy story, there was twins that were, one lady was a twin, she went through, or they were twins, but the one lady went to a traditional medical doctor, and by the time she had gotten to her wit's end, she was on about 60 medications. And then her sister found a functional medicine, integrative medicine doctor, and he got her on bioidentical hormones. And so slowly she converted her other sister over, because she's like, I feel great, and you're not feeling great on 60 medications, because it's one med treats a side effect and treats another side effect. So she slowly got her sister off those 60 medications. So there's a lot of things that we can key in and help ourselves to know symptoms that could be related to hormones before we think we're going crazy and needing traditional prescriptions. Of course, medications can be so helpful in times, but let's not use that as our first line that we first try when we're starting to feel off. So tracking your patterns and your mood, your cycle changes, your sleep. Some people will notice that their hormones or their periods have gotten less frequent, right? And so they're dropping periods, or they're having spotting, or they're having extra bleeding. It's interesting because it's not a simple slide down where the estrogen just goes down gently until it's done. Estrogen during perimenopause will go high and low and high and low, because what we're really talking about is the ovulation and the egg reserve, and the egg's volume is just declining. So sometimes your brain is going to stimulate to your ovaries. Okay, we're used to producing, releasing an egg every month. So if there's so few eggs left, or they're not good quality, then the brain might have to really send a loud message, and then all of a sudden there's all this estrogen produced, but maybe an egg may or may not come, and so there's all these ups and downs, and the signal from the brain is called the FSH, so it's the follicular stimulating hormone, and that's again going to the ovaries to try to get us to produce that egg, and eventually we just will run out of our egg reserve, or the ability to have good quality eggs released. And so we're going to be noticing that this FSH is so high because the brain's yelling and trying to get that ovulation to happen. And eventually after, 12 months of not being able to release any more eggs, that's the formal definition of menopause, like we said. But all these hormones can be a little haywire in the meantime, especially estrogen goes very haywire. So if you feel off in ways that are hard to explain, if you're not imagining it, you don't have to suffer in silence. We're all here to help, and your friends can share. Some of our individuals here have actually been on hormone replacement therapy and can talk about how you don't have to suffer and you don't have to wait years. Let's see here. Let's talk about Oprah. So Oprah has a quote that she wasn't just feeling off, she was completely out of sorts, and no one talked about it. So she experienced brain fog, fatigue, feeling disconnected from herself. She had palpitations, and she was given prescriptions like anti-anxiety medications. And for years, she wondered if her symptoms were depression or something more. Finally, she found a provider who gave her personalized hormone therapy. And at that point, it was like the sky cleared and I felt like myself again, she says. So now she has a huge passion to help women. Now, I could not believe Oprah's story. She is the woman who has access to and resources to everything. I was so discouraged to learn that she had the best of the best options and she still had to suffer this way. So I feel that you are all lucky that you're getting to hear this, because it's truly, I think, hidden from women in the mainstream. And I think it's a shame and a disservice, and it could be a little soapbox that I'm on, but I just really care about all of you, and I really think that if we were able to learn the truth without being clouded by the training that we learned about pharma, big pharma, and the prescriptions that are so available for the first symptom that we tell to our doctor, and that's what doctors are trained on. Doctors truly are not trained on the female body. So we have a little cute Instagram reel that you all have to go watch about the female body, and it's really, really funny. So go onto our Instagram and follow us and scroll through, and Sarah can again help you find that one. But we really have so many things unique about our bodies, and we're very much advocates here to try to help you understand what's going on and to know that you're different than a man and you're changing and changes in aging, but set you up for challenges unless you're educated. So again, education, I had to learn most of this on my own outside of the traditional nurse practitioner school. By the way, I'm Carol Bender. I went to University of Pennsylvania nursing school, nurse practitioner school, business school at the School of Wharton, and so I definitely have a lot of training, but it was not on this, and I felt very shocked when I was giving patients prescriptions with all my great training that weren't making a difference in their lives, and they'd come back and they'd just be frustrated. So thank goodness I went to a BioT training and I learned about all these hormones and how they actually implementing changes with hormone balancing made such a bigger difference. So again, how do we want to feel as we're going through perimenopause and menopause? Do we want to have mood swings, weight gain, sleep disruption, joint pain, feel fragile, insecure, angry, unsure what's going to come out of our mouths or our brains at any given point in time? I know pregnancy kind of made me feel a lot of these things, so menopause can feel like we're kind of losing our minds again. And I'm not saying that I know exactly from menopause experience, but I'm trying to set myself up so that I don't have to feel all of these things more than just during my pregnancy and postpartum periods. So do we want to feel like this, right? Like happy, calm, confident, smart, clear-minded, optimistic, loving, sexy. Do we want to feel coordinated, have strong bones and muscles, not be scared about falling or tripping? Do we want to feel resilient so we can have flexibility, have an active lifestyle, be motivated to do our day, and again, have uninterrupted, restorative rest and enjoyable intercourse where we actually enjoy and want to have intimacy? Do you feel any of these symptoms? The 3 p.m., 4 p.m. crash in the afternoon, the weight gain despite dieting. These we talked about a lot, but migraines and headaches, I swear that's one of the biggest keys that indicated to my mom where her estrogen was dropping. Vaginal dryness, that seems to be very common. Painful sex. Mental symptoms can be some of the most debilitating, because if you can't get your mind in gear, how are you going to make the choices to be healthy? Emotional symptoms, and again, disinterested in sex. That's not just a symptom of aging, and it does not have to be that way. I always go back to when I went to my first BioT training conference, and there were husband and wives that were both providers and had been on hormone optimization, and they were walking hand in hand all around the conference and running to the tennis courts together and running back to the hotel room together, and it was something that I wanted to aspire to in my 70s. It's just, we're living till 80, so we want to be optimal till 80, and most people's hormones, if they're dropping and they're 35 to 50 years old, that's a 30 to 40 year gap where we do not want to be suboptimal for the remainder of those years, and we want to find a way to figure out what actually works. So we believe that personalized hormone therapy is probably the #1 key for most women when it comes to restoring balance and relieving symptoms safely. There are many things that go in hand with that, like choosing the healthy fats, doing the right choices, but I know that with lack of motivation, it's hard to make the healthiest choices, and I've seen it with a lot of my patients that they need a little bit of a help, not everyone, but most people need a little help to get them making that choice easily. And then I put a little star there because we've all heard about Ozempic and the GLP-1 medications, right? And so how there can be a little bit of way to kickstart your healthy lifestyle and that weight loss. We love to help women along that journey too. mind-body connections, meditation, prayer, breath work, mental health therapy, and also connecting with other women, because there was a podcast, a TED Talk, that said that the most powerful predictor of longevity was social connectivity. So we need to be together. We need to be unified. Thank you so much for coming together, bringing your friends, and for joining us together in this. Hormone panels, blood testing, inflammation markers, bone health checkups like your DEXA scan can really help keep your care personalized and also key you into things when you might need to make a change. I don't want to talk too much, but I did get a DEXA scan when I was 29, and I had osteoporosis on my DEXA scan at 29. So I started testosterone replacement, and then I started having kids, so I promise I will one day go back and get you a follow-up scan and tell you what my results are, but I believe that I'm stronger because I haven't fractured any bones, and I was fracturing ribs like twice a year when I was 29. So I'm very excited that testosterone helped me with my fertility journey, and it really helped me with, I believe, strength in my bones and my muscles and my mind. So you can't start too young testing your labs and testing your bone health. Menopause is not a decline, and it can become a powerful upgrade. So we see these hormones. We talked a lot about how much hormones can be dropped in our menopause years. Estrogen, progesterone, testosterone are the main ones, but thyroid, TSH, and T3, T4, those are thyroid hormone markers that we'll check as well. There's about 400 body functions affected by hormones. We're about 50% lower risk of Alzheimer's and dementia when we have optimal hormone levels. And every year you can build back your bone density up to 8% a year with testosterone and bioidentical estrogen replacement. So hormones, they are these little chemical text messages that are sent from cell to cell. They're released usually from the glands. We have the testosterone, estrogen, progesterone usually released from the ovaries and also from the adrenal glands. And so we have thyroid glands in our neck that release the thyroid hormones. We have glands in our brain like the pituitary gland, and that's releasing signals to these other glands to tell them to release. So usually they work in a lock and key system. So when the hormone is released, it fits into a key, or like a lock, and then the key goes in and it unlocks the lock and allows the cellular functions to work, those 400 functions we talked about. So when there's no key, they're not going to unlock the door and do the effect. Testosterone, isn't that just for men? Another misconception. Well, we actually have 10 times more testosterone in our bodies at baseline than estrogen. It's very interesting. So what we notice with testosterone is that it does so many things in our body, and when we test women, they will actually tell us how great they feel when their testosterone levels are optimized. It helps with bone density. It helps with confidence. I had a girl in the Brazilian jiu-jitsu community, and she got her testosterone optimized, and she ran around to all her women in her community. She says, us Brazilian women, we're not taught to speak up for ourselves enough, but the confidence that I got on testosterone therapy needs to be shared with everyone. And I just feel like all women need to be empowered and be confident and realize that there is a way to do that intrinsically, naturally, and you can be the boss. So there is a decline with age between the 20s and the 40s. Like I said, my testosterone was like 56 when I was 29, and it should be over 100. And we try to get women, between 100 and 250 probably. So it ranges, but we want to get you optimal. Mental clarity, emotional well-being, cardiovascular protection, bone health, energy, sex drive. Testosterone, sex drive, it's not just for men, it's for women too. And actually having an orgasm too. That can be the missing piece for having an orgasm, or that decline in how frequent you have orgasms. Estrogen. Estrogen works on our skin and our tissue health, reducing our wrinkles, helping our collagen production in our face. It helps us with memory. And although estrogen gets the blame for being the moody hormone during our periods, it's usually because it's such a rapid drop in estrogen right before our periods. And then slowly as estrogen builds up, then we feel better again. But that rapid change is usually what causes those mood swings. So a steady level of estrogen throughout your lifetime is going to help you so much. And it's the big fix for the hot flashes. So there you go. Breast issues. Risks of synthetic estrogen. These are the things that we talked about, where the myths might have come from. So if you are on birth control for extended periods of time, you are at increased risk of blood clots and heart disease risk, and that is because it's synthetic and it's not the same key to fit into the lock appropriately. So you have these synthetic estrogens, they're floating around the body, they're not matching the receptors like they're supposed to, because the only way they can be exactly the same molecule as your body was used to producing is if they're bioidentical. And if it's bioidentical, then it's usually from a plant source, and that can't be patented or created in a lab by the FDA and patented as a new drug because it's something that's already in existence in nature. So to be able to be an FDA approved drug, it has to be synthetic and it has to be slightly different than your body. So we prefer, in all chances as possible, to avoid these synthetic altered hormones. So we really recommend, even if you have younger women in your life, that they can talk to us about other methods of, birth control and contraception. And also post-menopause, we don't really recommend using these synthetic methods either. So they can cause side effects. I mean, when I was on birth control, I tried 3 or 4 different forms during college, and they gave me all the anger and the weight gain and the fluid retention and headaches, and so I can attest to, some of the physical discomfort that came with trying them. So thank goodness I didn't stay on them long term. But what is hormone balancing? We talked about bioidentical versus synthetic. Does that make sense, the difference? Personalized dosing. So with the clinics that are integrative and functional like ours, you get a customized dose. You don't just get, this is the prescription of the I even forget all the brand names of the birth controls that I used to give and use, but they're basically just one dose, and here, take your 28 pills, or put this patch on and put this this ring in, and it's one dose. But we have personalized dosing, so you can do creams or you can do pellets, and really we can do shots too and pills, but there's just so much customization. Every single patient, right, Sarah, is like completely personalized, and nobody's dose or nobody's regimen is going to look the same. Yeah. So just in summary, the main optimal hormone replacement methods that we use will be to replace estrogen, progesterone, and testosterone. With women that are going through the perimenopause or premenopause, they probably won't need estrogen replacement because they're so high and low and high and low. We might just give them progesterone to help cool down the estrogen waves, and also DIM to help metabolize the estrogen waves. But post-menopause, pretty much everyone's going to need all 3 of these in most cases. So we talk about how there's pellet and cream form of estrogen, there's a cream form of progesterone, and that works more for localized. We usually do the cream application. If we want the progesterone, we put it intravaginally because that really helps the lubrication and reduce the vaginal dryness if the estrogen wasn't sufficient enough. If we're not doing, we're always doing progesterone sublingual as well, if we can choose our best preference. We do testosterone as a pellet or a cream in the bioidentical method, or also as a shot if it's somebody that's like, I really want to do shots because my husband's on shots and we just want it to be the same. We can work with them and help them, although we prefer it to be the other methods, for it being like more bioidentical. Oh, note, there is no FDA approved testosterone for women. This is also something that I think is going to change. I hope it changes, but it's also not super important. You guys all have the key to the best options anyway, because again, the FDA approved options are not bioidentical. So we work with compounding pharmacies that are regulated by the FDA, but they are allowed to produce things that don't have a patented brand name on them. So they're just a little cheaper for the compounding pharmacies, and the big pharma, doesn't really have a handle in that exact world. So these are the registered, trademarked, branded things. Notice it's like a very long name of progesterone. It's not just straight progesterone. Conjugated estrogens are different than estrogen. And we like to use the hormones that your body was producing and just give it back to you. Like with vitamin D, if you're low on vitamin D, we give you back vitamin D. So if we have low hormones, we give you a replacement of those hormones. Sarah, do you have anything to add to that so far?
Not necessarily. I think I covered it.
Okay. We talked about pellets a little bit. There's a raffle for a pellet procedure today, so if you're all curious what that would be, how many of you have ever heard of a pellet before or know what a pellet is? Cool. So 3 out of our group, so that's great. Pellets are inserted under the skin, and they will be delivering a steady release of the hormone over the period of time that they're in your body until they completely dissolve and they're gone. So 3 to 4 months is approximately how long they last in each person. So you're looking at a quarterly visit to the clinic to get them inserted. It's a little incision. There's a little, like a, tiny thin straw that the pellet is plunged down, and then they are closed up with a steri strip, no stitch, and you go off about your day. You have about 3 days of recovery until you can get back to life as usual with your workouts. Pellets are convenient. Again, we can put testosterone and estrogen through the pellet method, and then that person would probably also be taking a daily at night progesterone under the tongue. The other method of bioidentical that we've gotten a lot more into lately is the cream, because women like to have control over exactly what they're doing, and so they will put on a cream either intravaginally or topically every day. And I will say that the intravaginal does have very, very good absorption. So even though some people may not absorb through their skin, we are women and we have the option of having intravaginal options, whereas the men, they only have the cream topical option. So intravaginal can be super effective, and some people find that it has a difference for them in the amount of side effects that they have. Like for me, I'll just say I had more acne and water retention from the pellet, and it could be because I was, too young. Maybe I still was producing some, but the cream is just great. I'm very excited about the energy and the muscle building and the motivation to work out that I get with the intravaginal testosterone cream. We do recommend saliva testing if people are on consistent cream versus if you're on another form of hormone replacement. The blood test is usually able to catch the levels and tell us what we're working with. But we always do post-treatment testing. So if your levels were low, we want to make sure that we hit the mark and that we're in the range that's safe and normal and healthy for you. So many options. Welcome to your doctor's appointment, Mrs. Cinco de Mayo, and come and have some bone density boost. There's lots and lots of safe research. Like I said, we can provide you with all of the studies if you need to see them, but you can trust us that we've been doing this for almost 9 years and probably, thousands of patients, and at this point they are coming back year after year and very, very grateful for the prevention and the way that they feel in the short term. So here's the oral the oral hormones may increase your bone density by 1.5% per year, but pellets have been shown to improve it up to 8% per year. Oh, and just to know, this is not like a sales pitch. It's really my passion to help us, because when I learned in my master's program that 20 to 30% of women will die within 12 months after having a hip fracture if they fracture their hip at age 75 or older. So there's about 50% that never regain mobility, and 20% are placed in long-term care after a hip fracture. So falling and breaking your hip is so serious, and probably, a few of us are gonna have that in our lifetime. It's just such a high chance. So if we can protect ourselves by starting young and building our bone density up with natural methods. I've never seen a statistic this high. Show me one with osteoclast or any of the other Boniva, like the prescription-based osteoporosis medications. Unfortunately, they will build back bones brittly, so they're more likely to break when you do fall. Even if you have thicker bones, they're still gonna break more. So that's a bit of a concern, and I think that testosterone builds it back a little bit more in the way that your body was made to. Now, you still need your vitamin D, you still need your calcium, you still need your nutrients, and you still need your strength resistance workouts, but there's also the things that we know we can do to augment that. We have the 50% reduced risk of Alzheimer's dementia and the many, many functions that are helped in our brain by optimal hormone levels. How many people have aches and pains and feel like aches and pains are coming with your age? Not just Liz, right? And so we would love to show you the before and after in patients' symptom checklists of their joint pain going away when they get their hormones optimized. And so just a little thing, we're very passionate about pain relief here. We've started this clinic even before hormone replacement. We did regenerative medicine and joint injections with stem cells and PRP and all kinds of regenerative methods to help your body heal on its own. So that option is something that we actually have a Monday appointment available for. So you guys, if you have pain and you're like, what's going on? Because you're here today, you'll get a free scan and a free shockwave therapy treatment if you so choose to sign up for a Monday appointment. So you don't have no strings attached. You'll just get the scan, you'll get the information. It'll show you, the doctor will tell you what's the cause of your pain, and the ultrasound scan is so informative that you'll be blown away. And then you can get shockwave treatment to actually bring stem cell recruitment to the area and get it to feel better. And you'll get some, recommendations of what you can do about it. So testosterone will help in many of those cases. So maybe wait till your hormones are optimized to actually treat it. No, I'm kidding. So please join us on Think Good in Menopause with a celebration, because there's hope, and you can lift the veil like Oprah and restore your quality of life too.
Thanks for watching. I'm Carol Joy Bender, the founder and nurse practitioner at Joy Wellness Partners. If you found this video helpful, give us a thumbs up. Please subscribe also to our channel and share this video with someone who you think could benefit from it. You can also learn more information about these services by clicking our link in the description below. You can also leave a comment to let us know what content you'd like us to put out next week. Thank you so much for being a part of our community, and stay along with us for enhancing wellness in our world. See you next week.